Welcome to Staten Island University Hospital Spine Surgery Education course. We thank you for choosing us for your upcoming surgery. I'm Patty, specialist with the Patient Experience team. My colleagues and I will take you through the course created especially for you and your caregiver. Did you know it's been proven that patient education leads to better outcomes and experiences? And we're happy to review this material with you. Our multidisciplinary spine team is in fact much larger than what you see in this photo. The team is comprised of neurosurgery, orthopedics, anesthesiology, pain management, rehab, case management and social work, advanced clinical providers, perioperative team, nursing, and patient experience. Throughout this presentation, various team members in our spine program will review and explain topics that will help enhance the subject material for you. Allow the complexities and background activities to us. Your main focus should be on the following pillars: what to do and expect before surgery, on the day of surgery, and what to expect after surgery. We have broken down this material according to these three pillars, starting with what to expect before your surgery.
Hi, I'm Elena, your Senior Physician Assistant at the Neurosurgery Practice located at 501 Seaview Avenue. Around 4 to 6 weeks prior to your surgery, you may need a physician exam by your primary care provider. Depending on your medical history, you may also need to see a specialist such as a cardiologist or pulmonologist. After your required visits are completed, you will go for a pre-surgical testing appointment 2 to 3 weeks prior to your surgery. During your pre-op neurosurgery office visit, we will discuss the necessary appointments, dates, and provider options. During your pre-op neurosurgery appointment, please be sure to share with our clinical team if you are taking anticoagulant medication such as warfarin, also known as Coumadin, apixaban, also known as Eliquis, dabigatran, also known as Pradaxa, edoxaban, also known as Lixiana, ticagrelor, also known as Brilinta, clopidogrel, also known as Plavix, aspirin, that is 325 milligrams. Please note that baby aspirin or aspirin that is 81 milligrams is acceptable to take before surgery. Be sure to stop taking multivitamins, vitamin E, and herbal supplements including ginkgo, garlic, ginger, turmeric 1 week prior to surgery. During your pre-surgical testing appointment, notify the nurse practitioner if you are taking any other herbal supplements or vitamins. We recommend that you stop smoking 1 month prior to surgery. Smoking can result in the following complications after surgery: surgical outcome failure, delayed wound healing of bone and tissue, increased risk of infection, increased pulmonary complications, and increased risk of blood clots. Please talk to our clinical team if you are interested in learning more about quitting smoking. If you would like more information about quitting smoking prior to surgery, reach out to the Northwell Center for Tobacco Control by calling 516-466-1980 or visit our website at northwell.edu/quit-smoking. Contact your primary care provider for nicotine replacement for use during recovery as well. Now that you are informed about all the requirements for medical clearance for your upcoming surgery, we can continue into the next section of the course. In the next section, we will share information about how to prepare for your surgery. It is important to have your home prepared for when you are discharged from the hospital. After surgery, you will need help with tasks such as cooking, grocery shopping, laundry, gardening, and taking care of your pets if you have. When setting up your recovery center, please ensure that you can easily reach medicine, water, your telephone, a box of tissues, something to read, and your TV remote. To ensure your safety, you may want to consider tidying up your home prior to surgery. Set up your recovery center by removing loose wires, remove area rugs, use a nightlight and turn on lights when you get up, secure rugs and treads on stairs, and place a rubber non-slip mat on the bathtub floor.
Hi, my name is Anthony Conrad, Director of Clinical Care in the Department of Neurosurgery. Now that your home is prepared for your surgery, the next step is to attend your pre-surgical testing appointment. Your pre-surgical testing appointment will be at 242 Mason Avenue, Suite 6B on the second floor. On the day of your appointment, please park in the Mason Avenue visitor parking lot. The clerical team in the PST office will validate your parking. Our clerical team will help you check in, and a nurse practitioner will perform a medical exam, which I will go over in the next slide. Pre-surgical testing is a valuable part of your surgical journey. The pre-surgical testing appointment is comprised of a lot of activities and sharing of information. With that being said, please plan for an hour to an hour and a half long visit. During this visit, you will have to share with us the following: a list of all of your medications, including your over-the-counter medications and herbal supplements, a list of all of your drug and food allergies, and if you have received one in advance, please provide the pre-surgical testing intake form. This may have been given to you at your surgeon's office. If it was not, you certainly can fill one out during this time. Also, please bring a list of all of your doctors, your primary care doctor, and any specialty doctors that you might see. After the sharing of information, we will then begin our assessment of you. A nurse practitioner in the office will ask about your medical history, surgical history, and perform a physical exam. If recommended by your physician, or if you meet certain criteria, you may have an EKG or a chest X-ray performed. You will also be given instructions on what medications to take on the day of surgery, especially for conditions such as high blood pressure or diabetes. Additionally, you will be informed if you need any additional clearances such as stress test, echocardiogram, so on and so forth. Also, you will have blood work done in the office. Please note, you do not need to fast for this blood work. Staten Island University Hospital's spine program is proud of our quality care that we provide to our patients and our community. One metric we are particularly proud of is our low postoperative surgical site infection rate. We achieve this with the help of you, the patient, and this starts at your pre-surgical testing appointment. During this time, the nurse practitioner will give you Hibiclens soap and instructions on how to use it. To use it, you will go into the shower and rinse your body with water from the neck down. You will apply a thin layer of the Hibiclens solution to your skin from the neck down using 1/2 of the bottle. Avoid internal application. It is for external use only. Do not use it on your eyes, ears, or mouth. Allow the product to remain on your skin for a full 2 minutes. After 2 minutes, use a washcloth or something similar to then wash your skin gently and rinse. After rinsing, pat dry. On the morning of your surgery, use the remaining half of the bottle and repeat the steps that I just outlined. You are now prepared to report to the hospital on your surgery date.
Now you are fully prepared for your surgery date. In the next section, we will discuss what to expect on the day of surgery and your plan of care while recovering. On the day before your surgery, you will receive a phone call from the hospital telling you what time to arrive. Be sure to eat a light meal such as cereal, oatmeal, soup, salad, or a sandwich. Shower with special soap and follow the instructions shared with you in the last section. Make sure that you do not eat past midnight the night before your surgery. On the day of your surgery, make sure you have a small bag packed and ready to go. We recommend bringing personal toiletries, dentures, and comfort items such as a book or tablet. Please bring your insurance card and ID. If you have been diagnosed with sleep apnea and use a CPAP machine at home, please bring it with you. Your personal items will be stored in a secure locker while you're in your procedure. We also recommend wearing comfortable, loose clothing that you can also wear when returning home. If you have a planned stay in the hospital, you can bring extra clothing and a knee-length robe for extra comfort. Please bring a list of medications with dosages and times of day usually taken. If you have any allergies to medicines or food, please bring a list with you. Please leave any valuables such as your wallet and jewelry at home and your medications unless you're informed otherwise by your physician. On the day of your surgery, please enter at 475 Seaview Avenue, Hart Tower entrance. Please park in the visitors' parking lot located across from the Hart Tower entrance. When you register, the central registration team will validate your parking ticket. Once you enter the Hart Tower, you will go through our weapons detection system and be met by a patient experience liaison who will check you and your guest in. The liaison will escort you to central registration where you will be registered. Once you are registered, the liaison will escort you to the preoperative area where you will meet your care team.
Hi, I'm Dr. Modavala, Vice Chair of the Neurosurgery Department. In the next section, I will take you through the important steps we take while you are in our care in the hospital. In the pre-op area, a nurse will take your blood pressure, pulse, and temperature. Your surgeon will meet you before surgery to check in and answer any questions you may have. To ensure a swift recovery, you may be given gabapentin, Amen, Tylenol, and/or Celebrex. While you are in surgery, your family will be updated by phone and will be informed once you are in the recovery room. After your surgery, you will be brought to the recovery room where you will be monitored until stable. Once you are stable, you may be given a brace to wear when you are out of bed. After you are stable in the recovery room, you and your care team will discuss the best option for discharge based on your unique needs. Our clinical team will determine if you should recover in the hospital, in rehab, or subacute rehab, or at home. If your care team recommends you stay in the hospital, your length of stay may depend on the type of surgery that you had. If you had a decompression spine surgery, you could expect to stay in the hospital for 0 to 2 days. If you had a fusion spine surgery, your length of stay will depend on the type. If you had an anterior cervical discectomy and fusion, expect a 0 to 2 day stay. If you had a posterior cervical fusion, you might expect to stay 1 to 3 days. For thoracic fusion surgeries, expect a 2 to 5 day stay. For more complex thoracolumbar fusion surgeries, you can expect anywhere from a 2 to 7 day stay. Lastly, if you had a pain stimulator, you could expect a 0 to 2 day stay. This is similar to pain pump placement as well. The length of stay varies based on your unique plan of care. If you'd like more information regarding your length of stay, please ask your surgeon prior to your surgery. Your treatment plan for pain management will be tailored for you based on your medical history and allergies to medications. Your pain will subside each day as you heal. If you have any opioids left over after surgery, please bring them to a drug drop-off site. If needed, we have one present in our hospital. Our goal is to keep you comfortable after surgery. We can use a combination of medications to manage your postoperative pain. This combination of pain medications is called multimodal pain management. To prevent clots, deep vein thrombosis, and pneumonia, you will be prescribed medication to prevent blood clots during recovery in the hospital and potentially upon discharge. After your surgery, the clinical team will instruct you on breathing exercises and use of the incentive spirometer shown here. You should use this device 10 times every hour. Before you leave the hospital, your care team will prescribe any new medications to your preferred pharmacy. For your convenience, we can prescribe your new medications to Vivo Pharmacy, located in our main hospital building at 475 Seaview Avenue on the first floor. Your nurse will also give you your discharge instructions, including any changes to your medications.
Hi, my name is Tom Berticchio, and I'm the Manager of Rehabilitation Services here at Staten Island University Hospital. An important part of your post-surgical recovery will be rehabilitation services. On the first day after your surgery, you will be evaluated by a licensed physical therapist. The goal of physical therapy is to help restore your mobility so that you are safe and independent at home. To do this, a therapist will assess your need for a walker or a cane, teach you safe and pain-reducing ways to move in the bed, get up and down from the chair or a toilet. They'll also train you to walk and manage stairs safely. Finally, they'll provide you with strengthening exercises that you can perform during your hospital stay and at home. In order to get you home safely and maximize your recovery, our rehabilitation team will assess your need for home care and outpatient rehabilitation services. They will also provide you with recommendations for adaptive equipment that you may need in your home. While going home quickly after surgery can be distressing, our rehab team is dedicated to providing you with the best care to prepare you for a successful and speedy recovery in the comfort of your own home.
That concludes our course. Thank you again for choosing and trusting Staten Island University Hospital Spine Center. If you have any questions leading up to your procedure, please contact us at the Office of Neurosurgery at 718-226-4940 or email us at siuhneurosciences@northwell.edu. We look forward to caring for you.